If you want to know more about headaches and migraines during pregnancy, then have a watch and save of this video. And if you have had chronic headaches or migraines in your pregnancies, let us know in the comments what helped you and what you found was beneficial during your pregnancy or in the postnatal period. For some women, migraines and headaches can be very common, particularly in the first 3 to 4 months of that pregnancy, where those increasing progesterone levels are helping to maintain the pregnancy and keep it viable, and also before the placenta takes over. This can contribute to things like nausea, vomiting, not being able to eat frequently, for example, not being able to sleep very well and feeling very washed out and exhausted, and that all contributes to the headaches that some women can have in those first 3 to 4 months. However, in contrast, some women who experience migraines, particularly around their monthly cycles, their menstruation cycles, actually find that because of the hormonal changes that happen during pregnancy and breastfeeding, these become a very protective factor for not having as many migraines or chronic headaches. Now, it's important to note, while I'm going to be talking about standard migraines, standard chronic headaches that happen during pregnancy, it's really important that if you have a brand new headache, especially in your sort of late second to third trimester, you've got swelling of your hands and feet, you're just not feeling quite like yourself, you're feeling well, usually quite frontal with this headache, I want you to be able to call your maternity unit for urgent assessment, referral and advice. Headaches can be one of the major symptoms and signs of preeclampsia, and preeclampsia is more common after 20 weeks of pregnancy. The closer to 40 weeks a woman becomes, the higher the chance of developing preeclampsia. And this is where that individualised assessment is so important, and having that conversation with your own community midwives or your own triage midwives, depending on where you are. Now, the Migraine Trust has got a fantastic fact sheet on migraine and pregnancy that you can go and have a read of. And the fact sheet really highlights the hormonal links about why pregnancy is quite protective for many women who are used to having migraines outside of pregnancy. And the link is between increasing estrogen levels and endorphin levels as the pregnancy continues. So many women who maybe experience migraines or chronic headaches outside of pregnancy find that these can lessen. For the women who do not have auras with their migraines, the actual migraines will improve for about 7 in 10 women. Women who have auras with their migraines are more likely to continue having migraines throughout pregnancy from the research that we have got. Now, if you are already on medication for migraines or chronic headaches, then it's worth a conversation with your GP to find out whether or not these medications are safe to continue taking. And for anyone who's planning a pregnancy, it's also a good time to have a conversation with your healthcare professionals to find out whether or not those medications need to continue or whether or not they need to be discontinued or swapped out for something else. Individual assessment is so important when it comes to medications and with pregnancy. Prevention of chronic headaches or migraines is usually better than the treatment. You can consider the non-pharmaceutical route, things like complementary and alternative therapies. These are also on the Migraine Trust website that you can go and have a read of. It's important, if you do use any complementary or alternative therapies in pregnancy, that it is undertaken by someone who has got pregnancy training. There are lots of things to consider in relation to prevention and treatment. So one thing is reducing stress and thinking about things that you can do to unwind and de-stress at the end of the day. You know, can you think about things like pregnancy yoga? Exercise can really help as well. Hydration is really important to help with reducing the chance of headaches, but also by reducing the chance of migraines. Eating little and often. And on the Migraine Trust, it highlights that paracetamol is normally considered safe during pregnancy and breastfeeding, but they also go into the information on all the other different medications that are available. It's really important, though, if you're taking anything more than paracetamol, that you have a conversation with your doctor, with your midwife, to see what is or isn't safe. And some of these medications may depend on how far along into pregnancy you are. Medication has to be an individualised basis, which is where the bumps comes in. And postnatally, the Migraines and Breastfeeding fact sheets on the Breastfeeding Network have a really good resource for what is safe with breastfeeding. And postnatally, women can sometimes experience a migraine because of the drop in hormones that happens in that first week after birth and because of dehydration and sleep deprivation. There is, however, a protective factor in that breastfeeding can delay periods. So for women who have migraines relating to their monthly menstrual cycles, trying to prevent and delay periods coming back, for some women, breastfeeding can provide a benefit of reduced migraines or headaches. And consider either the pharmaceutical medication route to help treat headaches and migraines,